Hi, I'm Susan Davis, and I want to welcome you to a Bedside Chat with Susan. I want to talk to you about some of the challenges that we face at Sacred Heart. You know, the future of healthcare, it's hard to pick up the paper without reading about Obamacare or Medicare cuts, Medicaid cuts. Sequestration impacts us. We get the same 2% cut that the rest of the world does, or at least the rest of our country does. But it strikes me that you might be thinking about, what does this mean for Sacred Heart? And maybe even, what does this mean for me, you, our listener, my listener? You know, the future is so uncertain about how healthcare reform is going to impact us. We do know one thing for sure. It's going to change the way we care for patients, the way we get paid. And we have to be ready for that. But beyond getting ready for that, the here and now has created some real challenges for Sacred Heart. We have seen a decline in surgeries. Our admissions have decreased. And something called our payer mix has dramatically changed. And what a payer mix is the mix of different payers, insurers, Medicare, Medicaid, no pay, that brings revenue into the hospital, sort of like our paycheck. And right now, and over the past year, we have seen a 20% increase in our Medicaid patients, which is a real challenge for us, because for every dollar that we spend on caring for a patient with Medicaid coverage, we only get paid 60 cents. So I'm sure you have already figured that that's really a bit of a recipe for disaster, because if your Medicaid patients grow, that gap grows. So that the payer mix, our drop in volume, our drop in surgical procedures, has really put Sacred Heart in a place where today we have to rise and meet those challenges. One of the strategies that is so important right now is the relationship that we have with our medical staff. Our medical staff is our partner in caring. And our physicians are telling us that they don't feel welcome at Sacred Heart. They don't feel that they have a voice at Sacred Heart. And while those two things are hard to hear, they're easy to change, because they are welcome at Sacred Heart, and we can do a better job at giving them a voice in what we do to move Sacred Heart forward. And that's where you as associates can help significantly, because you see doctors, you interact with them every day, you care for their patients, and they want to know that they're an important part of that work. So, hug a doc. The second thing that we have to do, and where you can help, is with our costs. And this might be a little complex, but in supplies and our use of supplies, a percentage of every dollar that we take in our paychecks, 20% of our paychecks goes for supplies. So for every dollar that we get paid, 20 cents of it goes to buy stuff. If you look around the country at other hospitals, on average, they spend about 15 cents. So that difference between 15 cents and 20 cents represents a significant amount of money to us. And that's where everybody in the front line can make a difference. You know, in some ways it's little things, turning off the lights. In other ways, it's big things. It's sutures on OR tables. It's making sure that we only get a supply that we need. It's buying things in bulk. And certainly that's not you, but it is the hospital. So we get to take advantage of lower prices. And the closer we can get that 20 cents to 15 cents, the more money we will have to pay for the care we provide and our associates' salaries. So that's something that you can do. A third thing that I spoke to our managers about is about taking risk. Now, please don't misunderstand. I am not suggesting that you ever take a risk with a patient. But what I am suggesting is that you try and do things differently. If it doesn't work, it doesn't work. We can fix it. But think about the work that you do and how you can do it differently and better. Don't say no, it can't be done. Don't let the first thing that comes to your mind when somebody presents a new idea, well, we tried that and it didn't work. Or no, the policy says. The first thing that comes to your mind should be, how can we do this? How can we make it happen? So that's another way that we as associates can make a difference right now for Sacred Heart. The next thing I want to talk to you about is the most important, and that is always putting the patient first. If a patient asks us for something, we should be thinking about how can we make it happen. If you see a patient at risk for falling, for getting the wrong medication, you, me, our colleagues have a responsibility to that patient, to making sure they are safe. So from my standpoint, what we can do is always put the patient first and make sure our patients are safe. And now the final thing that might make you chuckle, but it's your ideas. They're invaluable. And I've challenged our management team to go home and think about one thing you are going to do differently tomorrow to improve the safety of our patients or to save money. And that's my challenge for you. Easy, right? I asked the management team to do that, and I have probably about 120 ideas. Great ideas. Some of them are hard, but some of them are very easy. So put all this together, and what does it mean? What it means is, in order to help Sacred Heart now, today, we need to partner with our physicians, always put the patient first and their safety, find and be creative about different ways in which we can provide service and care to this community. You can do it. I know you can, because your commitment to Sacred Heart and its future is has never, ever been in doubt in my mind. So help me, help our patients, help Sacred Heart. And what Sacred Heart stands for, and the mission and vision that the Daughters of Charity have for this ministry. Thanks.